For more on Republicans' renewed efforts to work out this possible health care deal, I want to bring in Wendell Potter now. He's a former health insurance executive and author of Nation on the Take. The project is called tarbell.org. It examines how money in politics impacts Americans. Nice to have you with us.
Thank you, Kate.
Let's talk about these changes that we're hearing about. We don't know exactly what may be in the compromise that's being considered right now, but we do have some reporting. My colleague Benji Sarlin reports the bill they're looking at this moment anyway would enable states to request a waiver to drop the ACA, the Affordable Care Act's community rating provision, which would allow insurers to charge sick people more for insurance than healthy people. It would also allow states to eliminate the package of 10 essential health benefits that insurers right now are currently required to provide in their plans. Can you explain a little bit of that to us? If that went through, what would substantially change for those Americans who are on Obamacare?
Oh, it would be really devastating. It would be tremendous for the insurance industry, in particular the for-profit insurance companies like I used to work for, because they don't like community rating and they don't like the essential benefits. They really, really want to go back to the days before Obamacare when they could sell junk insurance, when they could sell policies or price policies so high that people who needed coverage really couldn't buy it. One thing to keep in mind is that health insurance in this country started on a community-rated basis, and that means that the policies that were offered, the premiums were the same regardless of your age, your gender, your health status, or where you lived. And it was only that was in the late 1920s and 30s. It was only when the for-profit health insurance, life insurance companies saw that they could make a buck in this business that they came in and started siphoning off the healthy and frankly the well-to-do, and that's the situation we have right now. This legislation would make it very, very, very difficult for people who are getting older, people who've been sick in the past, to be able to get coverage that's affordable. And it would also allow insurance companies to once again declare people uninsurable just because of pre-existing conditions.
Well, let me ask you about that, because they're saying on Capitol Hill that they're not going to remove that popular provision, that they're still going to allow people with pre-existing conditions to definitely get health coverage. You're worried about that, though?
There's a disconnect. If you allow the states to opt out and you allow them to get away or do away with community rating, that's exactly kind of the back door of being able to get to what exactly I'm talking about. And the essential benefits are very, very important too. The insurance industry would love to sell very skimpy plans and let people think that they're getting some good deal. Here's another thing I think that lawmakers need to keep in mind. They're fixated on premiums, and that's because the insurance industry wants them and us to do that. They can sell, back in the old days, they could sell policies that had the appearance of being affordable. If you enrolled in those plans, though, and you got sick, you would be on the hook for thousands and thousands of dollars. It's why so many Americans file for bankruptcy even with insurance. They thought they had coverage that was decent, and they found out when they really needed it that it really wasn't. They were paying good money to insurance companies for a long time, and when they really needed those policies, they weren't worth anything.
Wendell Potter, nice to have you with us to explain some of this. Thanks.